everyone, this is Professor Sujata Sharma. I'm the president of Biofootprints, which is a society which is meant for science promotion. And today we're going to be talking about a topic that most people want to know more about, and that is how to keep your heart healthy. And with us, we have an expert, a very renowned expert, Dr. Amit Hooda. Welcome, Doctor.
Hello, Dr. Sujata.
So let me introduce Dr. Amit Hooda to you. He's an Assistant Director of Interventional Cardiology Fellowship Program and Assistant Professor of Medicine at Icahn School of Medicine at Mount Sinai and Michael A. Weiner Cardiovascular Institute. He's an interventional cardiologist with a specialized clinical focus in percutaneous coronary and structural heart disease interventions. He's a fellow of the American College of Cardiology and the Society for Cardiovascular Angiography and Interventions. He's actively involved in clinical research and has co-authored numerous manuscripts, abstracts, book chapters, in addition to national and international conference presentations. Additionally, he also serves as a co-investigator in multiple interventional trials. His current focus is on optimizing complex coronary intervention outcomes using imaging guidance. So after this wonderful, scintillating introduction of our expert, let's get started with the most frequently asked questions on how to keep your heart healthy. So Dr. Amit, I would first like to ask you something that I also want to know about, and that is, can a heart attack be prevented?
Thank you for having me on your esteemed Biofootprint panel. And yeah, I would like to say yes, to a certain extent, heart attacks can be prevented. I would not say like all the heart attacks can be prevented. See, mostly the heart attack happened in the age group of middle age, like 35 to 64 years of age. And 80% of them with premature disease are preventable. And yes, as an individual, we can do a lot. Like we can take care of our diet, which should be little more a healthier diet, I would say. We can avoid smoking. And if somebody consumes alcohol, take it in moderation and controlling the risk factors, especially like diabetes, which is like a pandemic back in India, especially in US also, obesity, which is a major problem in Western world, I would say, at present. But yeah, back home in India also, I think it's keeps increasing in the trend nowadays. And taking care of your cholesterol, if you have a high blood pressure, taking your regular medications to control those things will definitely go a long way in preventing the premature ones. Having said that, I would say like certain risk factors we can't change. Like as we grow old, we can't change that. For now, there is no medication for that. And whatever genes we have, like South Asian, especially the South Asian community here in United States also is at higher risk. I would say that way, because we have that genetic makeup, we can't change it. But yes, the modifiable ones, definitely we can change. And that goes a long way. That can substantially reduce our risk for heart problems.
Okay, so that's good news that we can actually prevent a heart attack. How about our diet? Because nowadays, as you might be knowing, that we are consuming a lot of junk food, which has a lot of salt, and nobody's really bothered. We are just eating whatever we can because we are also busy and we have busy lifestyle. So is salt really that bad for your heart?
Yeah, like if you consume salt in excess, definitely it's very bad for heart. Salt is linked to like elevated blood pressure. What salts, like in a simple words, if I say, if we consume more salt, it adds on water in our body, which ultimately increases our blood pressure and which is a risk factor for the heart disease. Yes, to a certain extent, like less than 200 milligram of salt is okay for a day. In simple words, if we have to tell someone like, कि भाई कितना salt लेना है, 8 tablespoonful of salt, like a small spoon, is good enough for a day. Like in our traditional cooking, we use salt in every vegetable and like while cooking. That's fine, but don't add extra salt over it. Like when the food is served, then some people tend to sprinkle more salt over it. I think that we can, as overall, we should avoid. And lesser is better, there is no doubt about it. But yes, and there is always this fad, like there now you must have seen, when you go to supermarket, you have seen Himalayan salt, sea salt, table salt, like hundred of varieties of salt are there. But yes, only unka jo hai sodium content changes to a certain extent, but otherwise there is no major difference. Every salt is a salt. So no need to purchase any of these, any costly salt. Whatever you have in your household, iodized salt, use it in the, maybe just एक छोटा चम्मच use करें throughout the day to cook your food. That should be okay. I'll add one more thing, like you rightly mentioned earlier, processed food. Definitely, in Western world, people eat a lot of processed food. Not in Indian subcontinent, where we tend to cook fresh food every day, because that's our tradition. So that habit is definitely healthier than eating a processed food or a junk food from outside, because processed foods tends to have more salt content. तो जो हमारी मदर्स और वो घर पे खाना बनाती है, I think that's really good.
So now that we have talked about salt, let's go to oil. So which is the oil which is best for cooking?
See, the oils which are rich in poly or like monosaturated fats, they are good. It is tough for a normal individual to figure out what are those. Yeah, you need not to go into the content to see what's the real thing. But in easy words, I would say tend to avoid butter, cheese, all those things जो हम घी यूज करते थे back home. But yes, cooking के लिए आप, some oils are very good जो rich हैं antioxidants में, like olive oil, safflower oil, flower oil, avocado oil. We have all these oils, but tend to use oil in limited amount. Doesn't matter which oil you use, all oil ultimately are not very great for the health. Minimum amount use करें cooking के time, and don't overheat them. One thing which we keep forgetting कि हर oil का एक smoke point होता है, और you can say कि अगर हम उसको heat कर देते हैं एक certain level के ऊपर, तो उसके contents break down कर जाते हैं. Like olive oil को अगर हम बहुत ज़्यादा heat कर देंगे while cooking or doing deep frying, so the effect of olive oil goes away. So it is not helpful. It breaks down. So हर ऑयल का एक पर्टिकुलर टेम्परेचर है. बिलो दैट इफ यू यूज इट दैट ऑयल, दैट विल बी रियली गुड. एंड जैसे कोकोनट ऑयल है, विच इज ए क्वाइट प्रेवलेंट प्रैक्टिस बैक in some parts of India, I would say that is really not good for health because it is full of saturated fat. And हम लोग भी यूज करते थे, like there are economical constraints also back in our home country. So don't try to reuse the oil which is already used. Don't reheat that oil. Use in minimum quantity, but usko dobara use na kare. That's not good for health. And whatever is in your budget, I would say use that oil. Keep changing it, but less is better.
अब आते हैं हम, we have talked about salt and oil. So now we are going to come to something which everybody is undergoing nowadays, and that is stress. I think even very young people, teenagers are experiencing it, और हमारी उम्र तक तो आते आते stress becomes a very, very normal part of life. So is stress also a factor for heart disease?
Yes, Professor Sujata, ये बार बार प्रूव हो चुका है साइंस में भी कि स्ट्रेस इज डेफिनेटली एक सिग्निफिकेंट रिस्क फैक्टर है. वो कैसे है, वो डायरेक्टली भी इन्वॉल्व करता है, जो हमारा एंडोथेलियम होता है ब्लड वेसल्स का, उसको वो डैमेज करता है. दूसरा, इनडायरेक्टली वो क्या करता है कि हमारे रिस्क फैक्टर्स बढ़ा देता है. लाइक समबडी इज हैविंग ब्लड प्रेशर, स्ट्रेस होगा तो उसका ब्लड प्रेशर कंट्रोल नहीं रहेगा. डायबिटीज है, उसकी डायबिटीज आउट ऑफ कंट्रोल हो जाएगी. सो इट्स ए डायरेक्ट एज वेल एज ए इनडायरेक्ट एग्रेवेटर ऑफ हार्ट प्रॉब्लम्स. सो इसलिए देखिए आजकल लाइक एवरीवेयर देयर इज ए कंसर्न की लाइक स्पेंड मोर टाइम विद योर फैमिली फ्रेंड्स, हैव समथिंग to relax your brain in between, have some hobbies, क्योंकि life is so busy. Even for all medical professionals also, you must have seen, and especially you who is like has seen decades of career now. So is tough because आप सारा दिन rush करते रहते हैं. You hardly gets time for your thing, even on weekends. यहाँ पे तो like फिर भी we have some weekends, but back home there is no weekend also. So there is no time.
That's true.
So yeah. और एक चीज और मैं स्ट्रेस देना चाहूंगा. Yes, our age old tradition like yoga, meditation, they are definitely very good remedy to reduce the stress. और अच्छी नींद, at least have 6 to 7 hours of sleep. Doesn't matter wherever you are, try to take a healthy sleep. That will go a long way to reduce your stress.
आपने कितनी अच्छी बात बोली that we must sleep for at least 6 to 7 hours, which is something that we are not doing. पूरे time तो people are sitting with smartphones and just wasting time and not sleeping when they should be. And also that you mentioned that yoga and meditation are a must because they reduce our stress levels. So now, Dr. Amit, I will ask you something which is the burning question. Should one take aspirin to prevent heart disease?
I'll say in that way, Professor Sujata, yes, it's helpful, but don't take it without your doctor's advice. क्योंकि aspirin definitely useful है जब किसी को already heart problem है तो फिर आप ले सकते हो. But अगर किसी को अभी तक heart problem हुई नहीं है, उसमें स्टडीज में देखा गया है कि इस हेल्पफुल बट इसके नुकसान भी हैं. जैसे ब्लीडिंग एक मेजर प्रॉब्लम, जो जीआई ब्लीडिंग है, आपके अल्सर्स वगैरह और इरोजन से कर देती है पेट में, वो मेजर प्रॉब्लम है. तो वी हैव टू बैलेंस द रिस्क वर्सेस बेनिफिट. इन सर्टेन इंडिविजुअल्स इट्स डेफिनेटली यूजफुल जो है, लेकिन वो डॉक्टर की एडवाइस के बिना नहीं लेनी. जैसे अगर किसी की प्रीमेच्योर हार्ट डिजीज की हिस्ट्री है फैमिली में, जिसका कोलेस्ट्रॉल बढ़ा हुआ है, ब्लड प्रेशर बढ़ा हुआ है, तो दैट यंग इंडिविजुअल इज एट ए वेरी हाई रिस्क फॉर हार्ट प्रॉब्लम. उसका ब्लीडिंग का रिस्क कम है, उस पे हम दे सकते हैं. बट लाइक आई सेड, आई विल स्ट्रेंथन द थिंग अगेन दैट ओनली टेक विद योर डॉक्टर्स एडवाइस. इनडिस्क्रिमिनेटली ओवर द काउंटर जाके कि मैंने एस्प्रिन ले लूं और मुझे प्रॉब्लम नहीं होगी, that will cause more harm in long term instead of helping you. एक चीज और मैं हाईलाइट करना चाहूंगा जो मैंने यहाँ लाइक यूनाइटेड स्टेट्स में भी देखा है. फॉर हेडेक और सिंपल पेन, people tend to consume aspirin like anything because it's over the counter available drug. So they think it's like a pain remedy. Yeah, it helps in pain, there's no doubt, but there are so many other less risky painkillers. Use them instead of aspirin because iska bleeding risk from our GI tract is quite significant.
Yes, Dr. Amit, NSAID-induced gastropathy, as we know, is something which is very worrying, and people don't think about it because उस time तो they feel suddenly relief मिल गया, अब क्या जरूरत है आगे की सोचने की, but later on it really leads to a lot of problems. So finally, Dr. Amit, I would like to know how to take care of your heart.
Yes, that's a real concern. Like even our patients in the clinic, they keep asking, so doctor, what I can do to prevent further events? So yes, you can follow a healthy diet. Like I said, diet which is plenty in fresh fruits and vegetables, home cooked food, instead of taking a processed food. Once in a while is fine. I will not say अब जैसा लाइफस्टाइल है कि उसमें आप ये कह दो कि नहीं आपने बाहर खाना ही नहीं खाना, तो lot of people will not, it's not possible or feasible. तो कभी कभी खा सकते हैं, there is no doubt about it, लेकिन most of the time घर में fresh खाना बनाएं and eat plenty of fresh fruits and vegetables, use less salt. If somebody consumes alcohol, so take 1 or 2 drinks a few days a week. Don't take in excess. Smoking, definitely we should avoid because I have practiced both in India as well as United States. I have seen कि Indian subcontinent में ये problem ज़्यादा है. Like young patients suffer heart attack a lot and mostly they were smokers. उनके और जो had risk factors नहीं थे, mostly they were smokers. So smoking is a major public health issue over there. And despite government banning all these things, still people continue to smoke. And I don't know how to tackle this thing, but it's an issue there also and here also. And if somebody has high blood pressure, sugar, high cholesterol, don't shy away from taking medications. because some people think medicines will be addictive. No, it's not like that. Medicines will just help to control that pressure or sugar in a limited range, and that will prevent your future risk. कोलेस्ट्रॉल के लिए काफी सारे पेशेंट्स इवन यहाँ पे भी कंसर्न रहती है कि स्टैटिन लेना चाहिए या नहीं. It's a big issue. Like, people will read online and they will come with like so many things, like I may develop Alzheimer, it may prescribe diabetes, but that happens in very rare percentage of population, I would say. The benefit outweighs the risk here. तो अपने डॉक्टर की एडवाइस पे ही लें, क्योंकि देर आर कैलकुलेटर्स बेस्ड ऑन दैट, जिसके बेस पे हम एक इंडिविजुअल का रिस्क देख सकते हैं कि इसको कितना हार्ट प्रॉब्लम होने के रिस्क है फ्यूचर में. उसके बेस पे हमें उसकी थेरेपी देनी होती है. तो वो just go as per your doctor's advice, I would say. Don't shy away from that. Trust your doctor, which unfortunately is not happening for last few years because of these Google and internet things, but it should happen. And yes, like spend time with the family and friends. If you are obese, try to reduce the weight, because obesity is a big pandemic happening everywhere. So don't gain. Even in kids, you must have seen a lot of kids in school nowadays, they put a lot on weight. They eat like their food habits are not good. तो हमें चिल्ड्रन के लेवल पे ही काम करना शुरू कर देना चाहिए, बिकॉज अगर हमारी हेल्दी हैबिट्स नहीं होंगी तो किड्स विल फॉलो आवर ओन बैड हैबिट्स. सो दैट शुड नॉट हैपन. So we should be a role example for our upcoming generation. Ki, these are the healthy practices, follow these ones.
Dr. Amit, you have given such useful advices to all of us. I'm sure the viewers who are watching us are going to take this message back home, that जो आपने tips दिए हैं, they are so useful and they are doable. You know, ऐसा नहीं है कि इनको कर नहीं सकते. थोड़े से minor changes लेकर हम अपने lifestyle को बिल्कुल बदल सकते हैं, as you said. And what you said was trust your doctor. Do not sit on the Google and search for things, because वो जो information आती है, it's not really trustworthy. And in the end, just listen to what your doctor says. That was really a very useful advice. And thank you, Dr. Amit. It's been such a pleasure having you here. This is one of the most useful videos that I have recorded, and it's going to benefit so many people. So I would like to thank you once again, and I wish that I could have you again on this channel.
Thank you, Professor Sujata, for having me here, and it's an honor to be on Biofootprints site, and thank you a lot. Okay, and I'd be happy to be back anytime soon. Not a problem.
Thank you so much. Thank you.